Meanwhile, hospitals here in New York still operating with visitor restrictions that some feel are now doing more harm than good. News 12's Beth Cephalou has that story.
There is a couple big hospitals that have good doctors, but their discretion is now they don't let nobody in.
When Joseph Gross's grandmother recently fell ill and had to go to the hospital, the family had to choose between a higher-rated hospital still not allowing visitors or a lower-rated hospital that did. The family chose the latter.
The only time when she can be calmed down is when someone is there. The minute no one is there, she gets frustrated. That's get the hospital staff frustrated, and nothing can be treated right if she's not calm.
Last year, the state enacted these visitation guidelines for hospitals. It includes a 4-hour visit limit, only one visitor at a time, and no visitors under the age of 18. Hospitals have discretion to expand or tighten those restrictions. Just last week, News 12 shared the story of an Orange County family denied visitation to their father dying of COVID-19.
A hospital didn't let someone end of life in. For what? It doesn't even make sense.
Yossi Gestetner is co-founder of the Orthodox Jewish Public Affairs Council.
It's time to end this harsh decree,
Which is now pushing the state to relax the policy.
I'm not going back to March and April when people were panicked and didn't know. We now know how things work better with the vaccines and antibodies and the PPEs. And hospital staff aren't exactly taken home in a tube quarantined. They go shopping, they go to, they live.
The council wants the state to repeal restrictions surrounding end-of-life care, resume child visitation, and expand the number of visitors and amount of time they can be bedside.
Frontline workers have vaccines. Tens of millions of people have antibodies. PPEs are available. It is high time, I think, to expand these 4 hours to certainly throughout the day, many more hours.
In Spring Valley, Beth Cephalou, News 12.
Well, a spokesperson with the state health department says their position has not changed and hospitals must continue to follow that guidance. The spokesperson adds hospitals can expand visitation or the number of visitors depending on patient status and condition if determined appropriate.